Nearly 1 in 5 U.S. adults live with a mental illness. It's a condition that doesn't discriminate, and it's anything but a one-size-fits-all. On its current course, it is positioned to become one of the greatest burdens on the 21st century's global health. This burden is also extended to families and often not discussed openly, leaving those who suffer with little to no support. Tonight, Montgomery Community Media will shine a spotlight on mental health. Join us for MCM Connects Adult Mental Wellness up next. Good evening and welcome to Montgomery Connects. Good evening and welcome to Montgomery Connects Adult Mental Wellness. I'm your moderator, Carrie Morris. I'd also like to welcome our studio audience and those of you watching us on Facebook, TV, or on mcmlive.org. Tonight we'll explore some of the most common mental health conditions, examine the barriers to access and treatment, and discuss the impact on our community. We'll hear from someone living successfully with the disease and from experts committed to moving those who suffer ever closer to the promise of recovery. We have two expert panels joining us this evening. On our first panel, I'm pleased to welcome from the National Alliance on Mental Illness in Montgomery County, also known as NAMI, the organization's Executive Director, Stephanie Rosen. And joining us from Suburban Hospital is Beth Kane Davidson, Director of the Addiction Treatment Center, one of the foremost outpatient treatment centers in our area. Also from NAMI, Rachel Stein is with us. You'll hear her personal struggles with mental illness and her success finding a stable place in her life. Welcome, everyone, and thank you for joining us.
Thank you.
Thank you.
So, big, vitally important topic, lots of moving parts, so let's get to it. So, Stephanie, your training is rooted in neuroscience and clinical research.
Yeah.
And Beth, you bring over 30 years experience in the addiction treatment space, which dare say has been anything but static, right?
Thank you. Yes, yes.
So before we get to the broader theme, Stephanie, would you just ground our understanding of what is mental illness as differentiated from mental health? Because I would venture to say you just can't snap out of it, right?
Yeah. So mental health is something that absolutely everybody has throughout their lifespan. It encompasses our psychological, our emotional, and our social well-being. Mental health affects how we act, how we think, how we interact with our outside world, and a mental health condition or mental illness is when any one of those factors are affected. And what further complicates things is that two people with the same diagnosis can experience completely different symptoms. So mental health condition is a broad umbrella of a lot of different disorders.
So if you would, speak to some of the contributing factors, biology, lifestyle, environment.
And you named quite a few. So a lot of things affect our mental health. It is a biologically based brain disorder, meaning that when someone has a mental health condition, there are can be changes in chemistry, actual structure of the brain, and it is biologically based. But there are also environmental factors, including exposure to trauma and family history of mental illness.
Great. And we know that there are a number of, prevalent conditions. So if you just wanted to give us a very brief overview.
Sure. There's a lot of different things. I mean, there's a huge book that's published that kind of defines all of them. Yes, the DSM. But they can include anxiety disorders, thought disorders, mood disorders, personality disorders. So there's a lot of different types
factors
of mental health conditions.
So Stephanie and Beth, and we will get to you, I promise. Is there an ideal time for intervention? When we talk about, we get so caught up in this fix me system, take action after the fact. Would you like to see more emphasis on prevention?
Well, I know for substance use disorders, absolutely, and mental health disorders as well. I mean, what I hope that people will take out of this is whenever you have an uneasy feeling about somebody's well-being, look into it, ask questions, don't be afraid. The sooner we can get to what's going on, the more effective the treatment's going to be.
Yeah, and
diagnosis.
There's not just prevention, there's also promotion. So mental health promotion includes resiliency, practicing resiliency and finding your strengths. And then there's mental health prevention, then there's treatment and recovery. So there's a whole spectrum of care throughout the lifespan where you can get help and also promote your mental health.
So why don't you just think about this very quickly. Do you think that mental health has an image problem, mental illness rather, has an image problem?
Yes, absolutely.
Yeah.
If you look at how many people reach out for treatment, only it's under 50% who could get treated in any given year, and a lot of that has to do with stigma.
Yeah.
Are there other hurdles, challenges that you experience that you would like to see addressed as you move through this?
Well, sure. One thing with substance use disorders, we're always looking at helping the patient understand that they need help. And what we often hear is, I don't have a problem, or it's not that bad yet, or I want to quit on my own. So it's educating the patient and the family members and people in the community that come in touch with that person.
Yes, thank you so much for this. So mental illness is a quiet epidemic because of the shame and negative judgment that society often attaches to those with a diagnosis. And those who need help the most are reluctant to speak up and consequently do not receive the services and care vital to their recovery. To shed some light on the importance of breaking down the stigma surrounding mental illness, let's take a look at this PSA.
Nutcase, schizo. You may not realize it, but these terms, often used to describe someone with a mental health condition, can be very harmful. In a country where 1 in 5 people are affected by a mental illness, it's time for all of us to step up and change the conversation. When the discussion on mental illness focuses on fear instead of hope, people struggling with these conditions get caught up in the judgment and shame attached to them. They become lost in all the talk and harmful words, and they may not get the support they need. But we can help by directing our loved ones to places like NAMI, the National Alliance on Mental Illness, for life-saving resources. Just because someone's struggle isn't obvious on the outside doesn't mean they aren't hurting on the inside. We need to see the person, not the condition. Join me, pledge to be stigma-free.
The importance of shifting the mindset and language of bias, stigma, and discrimination surrounding mental health can't be overstated, but changing public attitudes takes commitment and perseverance. So Rachel, welcome. In the spirit of examining stigma and on those who are most vulnerable, at what point did you recognize this isn't a passing phase, I'm not going to snap out of it, and you mustered the strength and the courage to seek help?
I think freshman year in college in 1994. And it wasn't an option. I wasn't functioning. So there was no option.
Okay. So when it reached that critical mass, that's when you said, okay. I was wondering if there were other factors influencing your decision, maybe not to reach out sooner.
Well,
maybe not.
So when it blew up, I was at my freshman year in college. And I no longer had the safety net of my parents and my home. And I went to school, and every time I came back for break, I was at the internist complaining of this or that or whatever. So during spring break, our internist, who we'd seen for decades, said to my parents, this is psychiatric, this is not physical. So there was, I was not functioning.
Yeah, so you just led to my next question, which is, people living without mental illness know good days from bad days, right? And so how do you now check in and distinguish from this is a bad day to this is a really, really bad day and I need...
So it's really interesting that you asked that question because I just had this discussion with my therapist yesterday. I had a busy weekend, Friday, Saturday, Sunday, up early, out late, like go, 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 go. And it was hot and whatever. And so I went in Monday morning and I said, I think I'm on the downswing. I just think I'm heading down. And she goes, Rachel, she said, wait a minute. Anybody would be exhausted by that weekend. So it's really checking in with the people who know me and know my tells, because I'm still learning what is a normal bad day and what is a like bipolar bad day.
A signal. So describe what attending to, and you just kind of did, looks like for you, and how do you characterize a stable day? What does a stable day look like for you?
It means I can get out of bed without ignoring the alarm until 12 or 1. It means I can function and go from running to CVS to tutoring a client to making dinner to reading a book and not needing to take a nap.
So are there services that you identified early on that supported your re-entry to the workforce? I'm talking about disability, honoring your condition, flexible work schedule.
So it took a long time. I come from a very conservative, straight and narrow family. You work 9 to 5, you put in your however many years, and then you retire.
Right.
And I tried and I tried and I tried, and I would always say, I'm really good at getting hired, but I'm really good at getting fired. And it took about 15 years to learn that the typical 9 to 5 job, regardless in what it was in, didn't work for me. And it took a long time to realize, wait, you are a square peg trying to pound yourself into a round hole, and that doesn't work for you, and that's okay.
You honored your owner's manual, right? Once you figured that out.
Yeah.
So what do you want others to know that you wish someone would have shared with you when they were experiencing their own bout of depression?
I think the biggest message I want to get across is that even though the tunnel may be long and it may seem infinite, there is always a light at the end of the tunnel. There may be ups and there may be downs and there may be cracks where you think you're at it, but you're not. Keep plugging away. There are people out there who care. There are people out there who will help you, whether you're insured, whether you're not insured, whether you are Medicaid or Medicare, whether you're embarrassed. Speak your truth and speak your story, and people will support you and help you get to the light.
I know we spoke about this, about, you know, this shame, this embarrassment, whether it's a cultural phenomenon or, you know, self-stigma, that you just want to be like everyone else, and you're really afraid, so you live in the shadows, and that's not helping anyone.
No.
Yeah, no, I think sharing your story and getting the support from the audience is extremely empowering. You know, I applaud everyone who shares their story, so thank you. But it's only through that we start realizing that more people live with this condition who understand. And also, you know, creating those work environments that support people with differing abilities.
Yeah, and that's, I was just going to say, well put. Well, but she was talking about stigma, and that is what often keeps people, substance use disorders, also from coming forward. And they begin to get afraid of, what is my family going to think? What are my neighbors going to think?
The impact of this.
What about my job?
Yes.
How can I go to treatment and leave my job or leave my family? And, you know, as we come together as a community and we begin to understand, no, we are here for each other. We are supportive. We can find the treatment.
Don't you think there's such a great opportunity in the workplace for this conversation to really root? Because so many people are afraid to come out.
Yes.
And
100%.
And it's a leading cause of disability worldwide.
Yes.
So it does affect, if
Yes,
you're going
it is.
to be, look at the bottom line, it does.
Productivity.
Yeah.
It's
And I think it's even a bigger issue that so many people are out for themselves. Well, if I help so and so, it's going to make me look bad. So instead of that, like teaching, when I started teaching, my mother always said to me, you're only as good as your next door neighbor. So if we could encompass that mentality into the workforce.
inclusivity, right?
Yeah, so okay, when I need to take a 10-minute solo break, Stephanie can cover for me. And it doesn't make me look bad, it doesn't make her look bad. We're working together as the team we should be in our company.
Yeah, it's
So-
it's a team, and it's especially in treatment for substance use disorder, it's each one teach one. So I may be the expert on substance use disorder, but if a person has the disorder and they need treatment and recovery, they need to become the expert as well. And then you get the community all treating and teaching each other, and they're supporting.
Do you think we're making inroads? Your organization is working so hard in the educational component, yours as well. Do you see we're moving?
Yeah, I think having the conversation is a great start. I know lots of people have been having this conversation for a while. This isn't new.
Right.
But I think the conversation is broadening. I know my mom sent me a text message last night. There's a section at CVS for mental wellness cards. And great, it's a greeting card now. So must mean something's changing.
I was in there today, I missed it. I did see the CBD oil, but I didn't see Wow.
It's another discussion.
Yeah, exactly, another time.
Yeah, but yeah, I do think we're making a difference. I think people are listening, and I think people, are talking, and the conversations are happening, and it's, getting fluent with the facts and comfortable with the stance.
That's a beautiful way you just said the fluent with the facts.
But, we still have a lot of progress to make.
Yeah.
More than 50% of people are not accessing treatment.
Yes, and that's
so
where we're
that's
going.
yeah.
Totally, because that is huge, huge. So thank you so much for that. And so in terms of what Suburban is doing now,
Yeah, sure, and it's a good segue in terms of what are we doing to help people get into treatment.
thank you. Just hold that for one moment. So knowing how to reach out and support those struggling with mental illness can be a daunting task, as we're saying. You want to help, but you're unsure how to begin. So this next video will give you some idea how to break the ice.
I've been pretty stressed lately. Can I bounce some ideas off you?
You don't have to solve it for me. I just need you to listen.
Believe me, if I could just snap out of it, I would.
It's like an ex-boyfriend that just won't stop texting you,
Well, that sucks.
You're not going crazy,
You're not alone.
I don't know how it feels.
I don't have the right words.
but I'm not going anywhere.
Get in here, come on.
So we can't have a meaningful conversation about mental health without addressing substance use and abuse and access to treatment. So I have a pretty startling statistic here. According to the Substance Abuse and Mental Health Services Administration, in 2017, approximately 20 million Americans age 18 or older reported having a substance use disorder related to alcohol or illicit drugs. And out of this number, 1 in 10 in need of treatment actually received it. What's up with that?
Yeah, I mean, we touched on it earlier in terms of it can be the person directly not wanting treatment, not perceiving that they even need the treatment. It can also be not wanting to take the time out, not wanting to come up to the employer or come up to their family. And then there's also treatment resources. I mean, we're really working hard in Montgomery County to make treatment available, and meaning available for everyone. Insurance or no insurance, where can people go? And with substance use disorders, when somebody needs treatment, you can't wait a month and then figure it out. You want to seize the moment.
So speaking about that, are we trying to take addiction, as you and I discussed, out of our vocabulary And if so, what are we replacing it with?
Absolutely. We are replacing the word addiction with substance use disorder. And the reason for that is we need to look at it as a medical disorder, and we need to integrate it into the health system and into primary care physicians, into, maybe the pharmacy that's sitting there and they have a little blurb of, do you have a problem or not? We need to integrate it into our system and not separate it out. I began in addiction, I do it too, substance use disorder in 1978, and we were very isolated. And I'm happy to say the integration is really happening.
So what is the relationship between psychiatric disorders and, I'm going to use the word addiction, why is that important?
Yeah, rarely do you just have a substance use disorder standing on its own. We're finding that there are co-occurring, it's called. So if you have a substance use disorder and you also have depression or anxiety, that's called co-occurring. And at Suburban, we do have an outpatient program specifically designed to address both of those disorders at the same time.
How do you do that?
Well, you have to work at, number one, abstinence, which can be difficult if the person has been self-medicating, using a substance to
masking their
feel
symptoms,
better,
right?
to mask the system, symptoms, or even to numb everything out. So first we help with abstinence, and then we also help people understand where were they putting that coping skill in, and what else could they put in there. And you got to marry the two together.
Yeah, so talk about the coping skills, because I'm sure that's a big part of this conversation. So how are we assisting our clients in terms of, cultivating those resources, pulling from coping skills so they don't have to, tap into that habitual pattern of using?
Well, I think treatment and recovery are very individualized. But there are different strengths that we can turn to. A lot of those are family support, friends, spirituality for some people, definitely access to mental health treatment and physical health care, as well as mentors can be extremely helpful. And I think I already said it, but friends. So this is actually, those are kind of 8 strengths that when we talk about mental health promotion, those are the strengths we promote. We do a lot of that work with middle school and high schoolers, but
very important.
Everyone has those strengths.
Mindfulness, yoga, exercise, nutrition.
It doesn't
just
require
simply
an RX for that stuff, right?
As she was talking earlier, having somebody that you can bounce off of. What is this a typical day?
Yeah, am I viewing this objectively?
Yeah.
Can we talk a little bit about the opioid crisis?
Absolutely.
Because it's so...
It's next door. Let's
Yes,
just
it
say
is.
that, or it's in your house.
It is.
And, that epidemic has really brought forward the lack of resources and the inability to get into treatment. So I think that has helped us all wake up. Suburban Hospital our program does treat opioid addiction. We also have started in our emergency room, it's called SBIRT, and it's screening, brief intervention, and referral to treatment. This is evidence-based, and it's amazing what we're seeing. These are peer recovery coaches.
What do you mean by that?
They're in recovery, stable recovery, from substance use disorder or mental health. It can be we have a couple of different recovery coaches there, and they are trained, not professional. They are going in as themselves, and we call it a warm handoff. So it's assessing people. We talked about prevention earlier. So if you come into the emergency room, and there might be something on there about your alcohol use, they would go in and have a conversation. And they would follow that person, and they would offer treatment if treatment was needed, whether it was outpatient or inpatient. Then they follow the person. So oftentimes we do have people that make an appointment for an evaluation with us, but they don't come. The peer recovery person would call them. And you know what? They'd keep calling them.
And I just have to interject for 1 second. it's really easy to lie to your mental health professional. It's not so easy to lie when you're talking to a friend one-on-one.
Yeah, good
and
point.
that's why I think that program is awesome.
Yes, it is. It takes the shame and judgment.
Yeah,
out.
absolutely. And they follow up. And so did you go? Well, no. And they give reasons why, how they didn't go at first, and then they went. And this is not just at Suburban. This is being placed nationally.
Do you have data that supports strides that you're making with this program?
Well, we just had our first outcome meeting actually last week. So, we're working on. We are seeing more people coming to appointments.
That's
more
great.
more engagement. We're not at retention yet. But
Very exciting.
It's very exciting, and we also have a support group for moms that have lost their children from opioid overdose. We can't forget the families,
Yeah.
and that it's called Soul Surviving Our Ultimate Loss. So that's very helpful. We have a free weekly education meeting to help families understand recovery, the process, what treatment's like.
Wow, you guys are really the leaders in our community dealing with this. I know NAMI does a lot as well.
Yeah, all of our programs are peer-based, so volunteers with lived experience, either living with a mental health condition or being a caregiver or a family member, because mental health conditions affect the entire family.
Yes, they do. Did you find in your own family that there was, were you reluctant to speak up, really talk to your parents?
It was so in your face. I mean, I was non-functioning. I couldn't get off the couch. My dad had to take off of work to stay home with me. I was literally, I don't know how I made it through finals, spring semester. I am only realizing now how much that impacted the rest of my family. I mean, I knew that my dad took off work, but I didn't understand what an emotional roller coaster it was for them, because all I could think about was me and not committing suicide. So,
and the power of forgiveness, forgiving yourself, forgiving what you put your family through. I'm sure that's a part of the recovery process. Yeah, and it's a day at a time. We started off by saying you just can't snap out of it, like Cher said, right? It's a day at a time, and I just think it's remarkable when you hear from people like yourself that you continue to take your pulse, and
there's nothing else to do than do it.
Yeah. So I love that. Any other final things before?
I mean, we just encourage people to share their story. Hopefully
the
this
stories.
conversation, helps people access treatment and to share their own, as you said, truth.
And I think really dive into the resources here in Montgomery County. Montgomery County, we're doing a lot. They're a task force for the opioid epidemic, overdoses. We are going through the fatalities. We are seeing interagency, what we can do.
Thank you so much. I would love to talk to you about this all night long, but I think we've really tapped and had a great opener. So I'd like to thank our panelists for joining us for the first half of MCM Connects Adult Mental Health. If you or someone you know needs help or have questions about anything that you've heard so far, you'll find the contact information for many of the area's treatment centers and other valuable resources at mymcmedia.org. So don't go anywhere. We have another panel of experts coming up after our break, and our conversation will continue with startling information on the cost of mental illness, what's happening with our veterans, and the impact the immigration process can have on newcomers to the states.
InfoMontgomery.org is your up-to-date directory for free and low-cost family, mental, and behavioral health resources. Whether you're insured or underinsured, InfoMontgomery.org is the county's best resource for ways to keep your family healthy inside and out. You can access mental health screening, counseling, referral, and treatment services. To connect with services and programs throughout Montgomery County, visit InfoMontgomery.org. Info Montgomery is an initiative of the Collaboration Council.
Listen, you're my friend.
I noticed you haven't really been yourself recently.
Yeah, I feel like something's up.
How are you?
Are you okay?
Is there anything you want to talk about?
I just want to know how you're feeling.
And listen, even if you don't know what to say, I'm here to talk.
No matter what you're going through,
I just want you to know I'm here.
I've got your back. When you want to talk, I'm here.
You have served our country and made us proud. Many of you are still serving. Some of you have come home to our communities where you continue to lead and contribute. Some have come back from deployment to find new challenges at home. Every family can have challenges. In or out of uniform, we need you to continue to serve and help your battle buddies, families, and communities. It's important that we all learn the 5 signs of emotional suffering: personality change, agitation, withdrawal, poor self-care, and hopelessness. If you or someone you know is experiencing one or more of these signs, reach out and offer to help. I reached out for the support I needed, and it made all the difference. This is how we keep our units, our families, and our nation strong. Visit changedirection.org.
Welcome back to MCM Connects Adult Mental Wellness. I'm Carrie Morris. In addition to the moral case for addressing mental health, there's also an economic one. Worldwide, it costs $2.5 trillion in lost productivity. Let's meet our panelists. Joining me now are Wayne Miller, director of the Silver Spring Vet Center, where among other duties, he provides counseling to veterans and their families, addressing critical readjustment issues to civilian life, with an emphasis on traumatic exposure in the armed services. Cheryl Aguilar, founder of the Hope Center for Wellness, a multicultural behavioral health practice. And although Cheryl works with people from all walks of life, she specializes in helping immigrants and refugees. And from the Montgomery County Department of Health and Human Services, we are joined by Regina Morales, manager of Child and Adolescent Behavioral Health Services, where her primary emphasis is on families. Welcome to you all.
Thank you for having us.
Thank you. So Regina, I'm going to start with you. You bring a deep understanding of the behavioral health service delivery model, including crisis services, substance use, abuse. You're on the front lines. So how are we doing delivering the necessary services to our very diverse population here in Montgomery County? Access to services, how are we doing?
I'm actually very proud of the work that we're doing, not only behavioral health and crisis services, but as a community, in collaboration with our providers, with our provider community. I think Montgomery County has a long history of valuing mental health and substance abuse treatment and services for the community, regardless of the person's ability to pay or their language or culture. So in terms of services, I think we have a pretty wide array of community services, for starting at prevention and going all the way through treatment, so outpatient treatment.
I was going to ask you about the continuum. So talk a little bit about that. What's the continuum of care?
Sure. So we have services available for whatever the needs are at the moment that the person presents themselves for services. So that could mean, for example, Prevention services are for community-wide education about substance abuse and mental health. But we also have services for when someone needs therapy, and it could be outpatient therapy. It could be if someone is having a mental health or behavioral health crisis, the crisis center is available 24 hours a day, 7 days a week. And anybody can access those services in the community. It's a free assessment and referral to whatever appropriate level of care is needed. And as people need more intensive services, those are also available. We have services for people that are availing themselves of outpatient therapy, and if someone is not able to because their needs are too severe, we even have a program that is called Assertive Community Team, which is the ACT team, and they actually go out into the community and work with people that have maybe fallen out of the treatment continuum. Maybe they're homeless, and therapists and psychiatrists and social workers, case managers, go to the alley and meet with the person.
So a lot of available resources. What is taxing the system? I mean, Medicaid, lack of psychiatrists, how are we doing with that, the system?
So I think we have a lot of what's needed, and I think we could always benefit from having additional services because the need is great. So, for example, one of the things that I think is very stressful in the system is the need for greater case management.
Yes.
Case management is something that is not reimbursable. So if you have somebody that is not able to make all the calls that are necessary to avail themselves of transportation or of psychiatry or housing, if they're having housing instability, they need someone to actually work with them hand in hand. It's not something that someone can maybe single-handedly do that.
And then if you have a language barrier on top of that, of course.
Language and culture, and some cultures have a greater stigma towards availing themselves of services. So all of that complicates the situation and makes it harder to serve those clients.
And we talked a little bit about, those outliers in the system, the people who just really have very severe needs and they're not receiving the support and access that they might need to help in their recovery.
Severe needs and complex needs. So we have the ability to serve people that have severe needs. When you add to the fact that there is a severe mental health or psychiatric issue, you add somatic issues, and you add addiction or substance use disorders.
Like we talked about.
Like we were talking
first
about
panel,
before, or that the person lost their housing or is not able to keep their job. All of that complicates things, and then you need a real community wraparound to help that person, and the level and the intensity of that service is hard to sometimes to maintain. So what I find though is that case managers and social workers and therapists love their clients and do everything they can in a very creative fashion to pull from here and pull from there and get the person what they need. But it is difficult.
Cheryl, you're on the front lines as well. This is what you're doing. You're working with all these clients, and what needs are you seeing that, the theme?
Absolutely, thank you. I echo that Montgomery County is doing a great job in creating services for communities, for different types of communities. But one of the problems that we have when it comes to serving community members is that we have to start with acknowledging the shortage of providers. We don't have enough of everything. We don't have enough psychiatrists. We don't have enough therapists. We don't have enough social workers. And when it comes to meeting the needs of special populations like the immigrant population or refugees, we hit an even bigger block in accessing and finding services that are multilingual, services that are trauma-informed, and services that are multicultural.
So is your practice, you must be inundated with this population who require services and guidance and direction for resourcing?
Yeah, we are, and we can look at the demand of services through two lenses. One is that there's a lot of need, and we don't have enough services. And even when we connect with other providers, there are waiting lists across the board.
Yes.
And talking about creativity and how to serve community members at large, we must think think creatively. So one of the things that we do to meet the needs of services is we provide support groups, and that's a way to have people receive psychoeducation they may need to deal with challenges they're facing. They connect with other people who are facing similar issues, and they receive the skills. And the other lens of having demand of services is that we can kind of equate that to decrease of stigma. More people
Yes.
are learning about mental health. More people are learning that it's okay to seek help, and I'm going to reach out.
And we're going to get to that absolutely, because that is a major part of the conversation, particularly honoring this population. So quite often, PTSD is associated with veterans who have experienced trauma in combat. However, it is not exclusive to the military. The key to PTSD is trauma. For veterans, the trauma may be caused by combat. For civilians, it might be trauma caused by a car accident, a natural disaster, a death in the family, situations we've all been exposed to. As a result, estimates are that over 4% of the nation's adult population, that's 14 million people, suffer from PTSD in a given year. So, Wayne, we come to you. It's a shocking but well-known statistic that every day, I didn't know this, between 18 and 22 veterans die by suicide. Talk to us about what you're seeing on the front lines.
Suicide comes in several areas, mostly in the adult 55 plus veterans that are near end of life, or they have means, they know how to use the means, they've had a major life stressor occur, so they choose to suicide
as
a way out. Because they are underserved when they're older. They're usually in nursing homes. They're throughout the community, and we really don't see them. We watch them in places playing dominoes and things like that, and it's getting out there and reaching them. And that's what Vet Center programs was built for, was outreach, to go to where they served, like we did in the military, in the trenches with them. And the closer we can get with them and educate, the main thing is to educate the population on what suicide is and and different preventions.
So I was reading about this. You know, some of our returning veterans to civilian life have a smoother glide path than others. That's a big part of the job that you're doing. So we train our veterans to the T, right, for armed combat. Are we doing a good enough job training them to return back home?
Veterans are well trained, the best trained in the world. And they go out and they do their job. And then they have to come home and wear another hat, being a father, being a mother, being a brother, a sister. And they have to continuously change these hats. So they're going from extreme, they're in the civilian life, they're well trained as a civilian. And then they're put in the military and they're well trained to be military. And then they have to take that hat off, come back home, in the family, and sometimes those roles change. The spouse, who happened to be female, goes out to war, comes back. I'm not cooking dinner and changing diapers and do that kind of things anymore.
But I'm talking about the ones who actually are no longer serving, and they are now involved in the civilian space.
Okay, and what we do at the Vet Center is bring them back to civilian. It's kind of like boot camp when you go to the military. They train you to be a soldier. Well, we kind of take them and retrain them, a boot camp to be a civilian again, to be able to deal with all these things are normal. Going through trauma and those things are normal for what you've done.
So when you and I spoke, and I hope it's okay to share this story, but you shared something that really resonated with me, which was your Come Alive Day was July 4th. And we're Leah, we're August 17th.
That's right.
So your Come Alive Day was July 4th, and you told me, which just, it's an unbelievable quote, was that you go to bed, I have to write it down, you wake up every morning putting Vietnam on and go to sleep every night taking Vietnam off.
Correct.
That's so powerful. Can you talk about that?
Well, we all have storage in our brains that we take memories from the day you consider life begins. We store memories, and they're from sight, sound, smell, hearing, and they're stored in the brain. When you have a traumatic event, it's stored in your brain in a certain place where it can be triggered at any time. Fireworks, 4th of July, the way people look, the way the people act, the way the people talk, the way the smells.
Sitting in a restaurant with your back turned.
Sitting in a restaurant because you don't know who's going to come through that door. And in today's society, we know who's coming through the door. It may not be the Vietnamese. It may not be the Iraq or Afghanistanis coming in. It could be just some person walking in the restaurant and shooting it up. So those heightened emotions and sensitivity and hyper alertness plays into play, and then it embarrasses you because you are acting and people are looking at you like you're crazy. Well, PTSD is not a crazy mental illness. It is a reaction to an event that makes your life out of order, and you're trying to get it back in order. And every time you go out in a community, things can trigger different triggers, different wars.
And if I may use the kind of metaphor, when you are assisting your clients go out of that emotional war zone and balance their responses to things, is that a big part of what you do with your clients?
It's a very big part. We do grounding skills, we do breathing skills, we do meditation skills, we do reframing of the brain. Sometimes they don't know what happened, so they make it up in their head because of all the things they've learned or seen, and they think that that's what happens, and it traumatizes them. So what we do is we try to get them to reframe those traumatic events that may come out better, so that when they do think about it, they really do. The grounding, the breathing, they say their name, their date, the time it is, the year it is, and what triggered them just then. You know, you're not July 4th, 1969, lying on the battlefield dying. You were sitting in your car and some car backfired behind you that sent you into a situation, especially with military sexual trauma, the same thing.
We're going to get to that because I want to talk about that stuck space, the stuck state.
Correct.
So we talked about stigma at the top of the show and how it is a common barrier to prevention, diagnosis, and care. With 46 million people suffering from mental illness in this country, stigma touches nearly every family here.
Friends, community, we need to help each other. Did you know that 1 in 5 people in the U.S. has a diagnosable mental health condition? That's nearly every family in America. This affects us all, including our Latino community. Friends, family, and neighbors may be suffering emotionally and not recognize the signs or know how to ask for help. It's time we pay better attention to our emotional well-being. Disculpen? This is how we keep our families and our community healthy and strong. Learn the 5 signs of suffering: personality change, agitation, withdrawal, poor self-care, and hopelessness. Then reach out, connect, show compassion, and offer to help. ¿Está bien? Know the 5 signs. You just might help someone you love. Visit changedirection.org.
The most recent studies show that the number of foreign-born asylum seekers, refugees, and other immigrants living in Montgomery County has increased 32%. And despite an increasing number of reports showing that detaining immigrants can be harmful to their physical and mental health, countries continue to do so. Big thing we're dealing with right now, the immigration crisis. What are your thoughts?
It's a big crisis, and the worst part about this crisis is this a man-created crisis due to very deficient policies that are harming individuals. And we can spend a day or a week talking about this topic, but I think it's important that we understand that the negative rhetoric that we're hearing in the news and in politics is really impacting community members who are fleeing incredible trauma. They're coming, in most cases that we're seeing through the border, they're coming fleeing situations that are deplorable, situations of violence, situations of political unrest, situation of extreme poverty, and they're coming to seek that American dream that many people talk about. They're coming to find safety, and what they're finding is that they're being criminalized and treated like, I don't even want to call it second-class citizens, but they're being treated like no
back where you
citizen should
came
be
from.
able to, exactly, like we don't want you here.
Well, it's an enormous problem because the numbers, right? The numbers that are coming, and the system is trying to, figure it all out. I read that you emigrated to this country from Honduras when you were 14 to New Jersey, right? So,
That's right.
how does your experience inform, your mission?
Thank you. Absolutely. I think as an adult, I can reflect back on my experience and realize that it was a really happy moment to be here, but it came with a lot of challenges, transitions, changes, moves, whether it's from one city to another, let alone one country to another, are some of the main factors that contribute to mental health challenges. And my experience was happy, but it also came with challenges. And now as an adult who can understand what opportunities there could be for other families, I bring that into my work. For any newcomer that comes to a new place, whether because they want to or because they were pushed to leave a place that they belong to or they cared for, there's a process of acculturation, a process of adjusting to a new environment, adjusting to everything new food, new music, the way that we celebrate holidays are different. So that change alone requires some support sometimes.
And as it pertains to this population, those who need mental health services, what are you hearing from them? What are their barriers? What are their barriers to access?
Absolutely. The first one is finding services that are cultural competent and finding services that are within their language.
Yes.
Many jurisdictions, including Montgomery County, are working towards securing more access that is cultural competent, and there's a translator line that people can use, but that's not enough. We need to do more in recruiting people who understand these communities and recruiting people who are trauma informed, who can help community members integrate better.
You experiencing, Regina, similar things in your line of work? Do you see the opportunities here?
Absolutely. I second everything that you were saying, because what we find is that as much as we try to have sufficient services, there's never enough. There's never enough Spanish-speaking or other language-speaking therapists. And it's just a lot easier if the therapist is able to communicate in the same language rather than using a language line. So the need is great. As well as we're doing, we could always be doing better and more.
And I wonder how many people are really afraid to come forth because of the anti-discrimination and fear of being deported and everything that goes with that, right?
Absolutely, absolutely. Yes. And one of the things I think that we're seeing is that in the adult mental health system, many of the mental health problems that people present with are really trauma. So it may look like another disorder until you treat the trauma, and we find that a lot of the clients that we're working with that really have significant and persistent mental illness, many times those symptoms are rooted in real trauma that they bring from experiences that they've had.
Would you say a healthy percentage is due in part to being detained, being separated from your families?
Yeah, I wanted to add on to that. Imagine if your first interaction coming to a new place is what we're seeing now. You don't belong here. We're going to put you in the worst conditions because we want you to self-deport. Imagine if that's your introduction to a new place. It's going to be really hard for you to, it's not only traumatic, and then it's going to be really hard for you to trust other people. So even though I want to help the community, I may also represent an authority figure who they don't know if they can trust. So I think that's one of the things that we're seeing, and that's why it's important that all of us as trusted community members can learn about the resources that we have in our community and can share with other people who may be at need. There's a huge movement right now in bringing services where community members are at. So whether that's schools, whether that's churches within our community. So we are, as providers, trying to think creatively to bring services to where community members already frequent.
And a lot of times trauma too, like for mine's visible.
Yes.
So it's easier to deal with. There's something there, something physical. When you have mental health, it's hidden. They're hidden scars. It's not just out in the front. You don't see them unless you ask. Plus, we need more trained people in those fields. Hispanic population, very underserved in the veterans population. The homeless, at least in Montgomery County, is great. That's wonderful. Here we do a great job in Montgomery County with our homeless, and we do a great job with our veterans population. When we get to the civilian population, a lot of times it's hard because sometimes they can't afford the care. Sometimes they only get short periods of time for care. At least at the Vet Center program, and a veteran is free. It's long term. There's no beginning or end. Well, the beginning is coming in for the first time. We don't wear white coats and carry around clipboards, and when they walk into the place, it's like walking into their living room.
Yeah, yeah.
They come into our offices. Our offices are well decorated, and it's that mental status that they don't want, and our front door doesn't say anything about mental health. So sometimes that stigma gets them to come in, and then they trust you. And then you can talk to them, especially if you've had some kind of affiliation with who they are. And the Vet Center program, just like a lot of Montgomery County mental health is they try to represent their community. So if we have more women, then we're going to have more women staff. If we have more veterans, we're going to have more veteran staff. If we have more Hispanics, underserved, we don't have, because people aren't going to school to learn to be mental health professionals.
Right.
These days they're doing other things, and everything's fast paced, and they got to have the money now, and we all know that we get paid a lot of money in mental health as providers. We make a lot of money. And I say that jokingly, but I say that truthfully too, that sometimes, and it's a very difficult field to be in, because I have to be mentally
fit,
healthy. And
I was going to
that
ask
takes
you,
a
what
lot.
keeps you up at night?
Well, being old, prostate.
God.
I'm being serious.
Whoop.
Yep.
I thought about that when I read it.
Yes. Again, sometimes it's hard to go to sleep at night because I have all those stories and all those things people trusted me with. And where do I do with that? Where do I keep it? You know? And how can I, because each individual is an individual. No two stories are alike. It doesn't matter what their trauma is, it's a trauma to them. And that they need to be treated that way, and with empathy and with respect.
Thank you, thank you, thank you. I have learned a lot and hope you have too this evening, and special thanks to all of our panelists, our studio audience, and those watching at home. Once again, if you would like further information on any of the organizations and services represented here, you'll find them on MCM website, mymcmedia.org. You'll also find a list of emergency helplines and other sites that provide information or services. Tonight, we started a necessary community conversation on mental health in adults, a subject that touches everyone in this room and beyond. Discussions like this can put us all on the path to recovery. Let's keep the conversation going. Thanks again for joining us, and good night.